Hey, I'm Tamara Kendacker, and you're listening to The Decibel from the Globe and Mail. Pregnancy and childbirth are supposed to be wonderful, exciting events in a person's life, but they can also be scary and anxiety-inducing, even in non-pandemic times. You worry about the health of the baby, about complications during childbirth. And for those who got pregnant or have had to give birth in the last 15 months, the pandemic added a whole new layer of uncertainty. At the beginning, there were a lot of unknowns. What were the risks to you and your baby if you were infected with COVID-19? Would you have to give birth alone, in a room at the hospital? And then the question became, can we convince pregnant people to get vaccinated when they're told to avoid putting all kinds of things in their bodies, like alcohol and sushi and even coffee? The science around the coronavirus and pregnancy has been evolving very quickly, but we do know more now than we did at the start of the pandemic. We know, for one, that some pregnant women infected with COVID-19 are getting way sicker than non-pregnant women.
One thing we do know clearly is that the virus is dangerous to women. So that's part of the reason why there's really a push on now to try to get women vaccinated and keep them safe.
Kelly Grant is a national reporter for the Globe and Mail, and she spoke to two women who were hit with bad cases of COVID-19 while pregnant and ended up giving birth in the ICU. And you'll hear from both of them on this episode. Today on The Decibel, why pregnant patients with COVID-19 are filling up ICUs. Hi, Kelly. How are you?
I'm well, Tamara. How are you?
I'm good. Thank you so much for coming on the podcast. So, you recently spoke to some pregnant women who got really sick from COVID and they had to be separated from their babies at birth. Can you tell me about them and how that happened?
So the first of the women I spoke with was Natalia Warwick. She was working from home at the time and doesn't know exactly how it found its way into her home.
Kelly, I want to say it was definitely probably community. I'm living in a multi-generational household at the moment. We're with our in-laws and there's 8 of us in the house, some of who still work. I think 5 out of 8 of us in the house ended up testing positive.
So in Natalia's case, she was young, very healthy, no underlying conditions other than her pregnancy.
I had all of the classic symptoms. Like at first, I wasn't sure if it was just me, being tired and feeling unwell because I was in my 3rd trimester. But then I got hit with a fever, a dry cough, fatigue, just very lethargic, very short of breath. And the shortness of breath just kept progressing, which is what ended up leading me to call an ambulance and go to the hospital on May 4th.
And once she arrived, the doctors assessed her and looked at her case and thought, we need to get this baby out as soon as possible. The baby didn't seem to be in terrible distress, but the real concern was Natalia's health and how much trouble she was having breathing. So they gave her a general anesthetic and did an emergency C-section.
And I know you also talked to a woman named Trisha Mayer. Can you tell me a bit about her?
Yeah, so Trisha was 38 years old and she was pregnant with her 6th baby.
So I would have been 32 weeks because I had him at 33. So I would have been about 32 weeks.
She also lived in the Hamilton area. And, in a similar fashion, she had been home actually on sick leave from her job as a PSW. And she lived in a house with 5 people, 3 of her kids and her fiance. And again, not exactly sure how the virus found its way in.
It must have been I was trying to think back. And I think just being out and maybe shopping or something I'm still trying to think today, because there was so many people in my house and everybody got sick at different times that it was confusing.
But once it did, she got real sick really quick. She tried for about a week to sort of handle the symptoms at home until, again, things got so bad for her that, she ended up calling an ambulance as well.
I didn't want to go. I know it sounds bad, but I knew from the day that I that's why I tried to avoid going to the hospital, because I knew they were going to take him out. I was so worried that I was going to stop breathing.
And just a couple of days after Natalia, she also was forced to give birth by an emergency C-section, also at St. Joe's.
Mm-hmm. What happened the day that their babies were born?
So in Natalia's case, they did some testing beforehand.
And then, within those few hours, they're like, okay, you know what? We're sorry, but at this point, like, we can't risk it. We're going to do a C-section, but because your platelets are so low, our only option is to put you under general anesthetic and put you completely under. And then on top of that, as I'm laying down, they're like, so because your platelets are low, we're gonna transfuse you and we're gonna do everything in our power, but just so you know, worst case scenario, we might have to do a hysterectomy. And I was like, just add it to the list of things to scare the heck out of me before you're putting me under. And I'm like, oh my God, so what if I wake up and I can never have kids again?
And in the case of Trisha, she was able to stay awake during her C-section, but it was fairly traumatic for her.
All my kids were natural, no drugs. So this was like totally different experience. And they're doing all this stuff to your stomach. You feel so alone because nobody's there. And I kept remember asking the doctor and the nurse, like, can one of you guys just please come stand by my head and talk to me? And and I don't know who it was. I just remember it was the gentleman. He came and stood beside me and he was explaining everything that was happening and telling me when they were about to do it and when the baby was out and everything.
What happened next? Were you able to see him?
No, that was the hardest part, I think. Today I'd still cry over it. I didn't get to see him. Like, one of the nurses, she's like, as soon as he comes out, I'm going to take what's your password? So I told her my password, and she's like, I'm going to run over and try to snap a picture of him for you, because I was like, well, can I see him? And they're like, no, like, NICU's standing by. As soon as he comes out, we have to take him right away, and they don't tell you anything. I kept asking, like, oh, is he, like, what's going on? Is he okay? Is he breathing? How come I don't hear him crying? I didn't know anything.
Now, fortunately, in both cases, the babies are doing really, really well, and both women have recovered really nicely. But the birth experience itself was very traumatic.
I can't imagine being that sick and in the hospital and then having to give birth to your baby and then having the baby taken away.
Yeah, and I think the thing is that, when women have C-sections, and especially if it's a premature baby, sometimes those children will be rushed away so that the, doctors can ensure that they're doing well. But I think the other wrinkle that made this really difficult is that both of these women were infected with COVID and were contagious and had to not only recover from the virus and their C-sections, which were major surgeries, but they had to serve out their isolation time. So neither of them were able to hold or see their babies for the first week of their lives because they had to stay on the COVID ward in isolation.
Mm-hmm. So what do we know about the kinds of risks that pregnant women face if they get COVID-19?
First off, I had a couple of doctors really emphasize this, so I want to be clear about it. The absolute number of women who get pregnant, get COVID, and then wind up in the ICU remains really quite low. However, what we do know is that in comparison to women of the same age who are not pregnant, in Canada, it looks like they have about a five times greater risk of winding up in the hospital or in the ICU. Now, those Canadian surveillance numbers, which come from a project led by some researchers at the University of British Columbia, they're based on data up until the end of 2020. So that doesn't include the heights of the second or the third wave, when anecdotally speaking with OBGYNs on the front lines of this, they said particularly in the third wave, they did see quite a few more women who were pregnant and were really sick enough to require ICU care and the kinds of emergency C-sections that Natalia and Trisha underwent.
Mm-hmm. I actually read this Wall Street Journal story about how pregnant women are dying of COVID at twice the rate of last year in Brazil, and researchers are blaming it on the P1 variant. And I know that there are similar worries in India. It's thought that pregnant women are increasingly being affected by the new strains. I wonder what you can tell me about how the new variants are impacting pregnant women. Do we know much about that in Canada yet?
We don't know as much as we would like, again, because that surveillance data really only goes up to the point at which the variants really took off here. What we do know in general is that particularly the B117 variant, which is the variant that is most associated with Britain, and that variant is by far the most prevalent variant in Canada now, that it does look, there's some debate about this, but it does look that it is in general puts more people into hospital and seems to be deadlier. There's a bit of disagreement in the research on that, so I want to be careful on that front. But it stands to reason that a variant that causes more severe disease in general would also cause more severe disease in pregnant women. Mm-hmm. And I do know in Natalia's case that she does know that she had the B117 variant.
Mm-hmm. And why are pregnant women at higher risk when they get COVID?
Well, pregnant women are generally at higher risk from respiratory viruses. They're at higher risk from the flu, for example. Part of the reason for that is just their lungs are under a different kind of pressure because they are, in essence, breathing for two. Their lungs are sort of crunched up by the baby's space. They are, their heart rates and their lung function are a bit different because their bodies just have this extra burden of also breathing for, in a sense, the babies in their tummy.
And what kind of risks does COVID-19 pose to the fetus?
So far, it looks like there has been very little of what is known as vertical transmission, which would mean an infected mother passing the virus on to the baby in the uterus before the baby is born. So that doesn't seem to be much of a risk at all. And as far as infants themselves, those who have gotten COVID have, like most children, done really, really well, primarily asymptomatic cases. That being said, it is still a novel virus, and if you could prevent infants from getting it, you'd like to. So one of the advantages we're learning of giving the COVID-19 vaccine in pregnancy is that it does look like mom passes antibodies on to babe, very similar to what happens when women are given the whooping cough vaccine or the flu shot during pregnancy.
And so is it fair to say then that babies, if they do need intensive care, it's usually because they were born early, not necessarily because they were infected with COVID?
Yeah, definitely. The real risk for babies here is being born preterm. And so there's a couple of reasons why that happens. They can be cases like Natalia's and Trisha's, where the preterm birth is medically indicated. Mm-hmm. And then there also have been some cases where women who are infected go into spontaneous preterm labor.
Mm-hmm. So this is why then there has been such a strong push to get all pregnant women vaccinated.
Yeah, there has been now. Although what's really been interesting is that push has really only come on in the last couple of months, or maybe even a little bit less time than that. In Ontario, it wasn't until towards the end of April that they decided to move pregnant women into the highest risk category and really put a push on to get them vaccinated. Early on, there was a little bit of caution, I would say, from public health authorities, from the National Advisory Committee on Immunization here in Canada, and from Health Canada, where they weren't in any way saying that they suspected the vaccine would be dangerous. But what they were saying early on was just, we don't really know. And the reason we don't is because pregnant women were explicitly excluded from the initial trials for the vaccine. Female participants actually had to take a pregnancy test before they enrolled, although a handful did wind up getting pregnant because, life happens.
Yeah. And why is it that pregnant women weren't included in those initial trials?
Well, this is actually an issue across drug and vaccine development generally. It's rare that pregnant women are included in trials, and women's health advocates have really been pushing to see that change. I mean, part of it is just an abundance of caution really around anything involving pregnant women and their fetuses. But what advocates for adding women to those trials say is look, you're not doing women a favor by waiting until a drug or a vaccine is widely available to discover if there's any sort of problem.
Mm.
So now that these vaccines are on the market, there are trials. One is sort of large pregnancy registries where women who do choose to get the vaccine are followed. So in the United States, we have some data from their registry, mostly from women who received the vaccine in their third and second trimesters. And so far, there's no safety signal to indicate in any way that the vaccine is dangerous to either women or babies. In Canada, we are doing something similar, although we don't have any results yet from those registries, and that's part of the reason why there is now such a push. Because one thing we do know clearly is that the virus is dangerous to women. So that's part of the reason why there's really a push on now to try to get women vaccinated and keep them safe.
So how did the women that you spoke to, Trisha and Natalia, feel about getting vaccinated?
So initially, like before all this happened, of course, they were both a little nervous.
And I was hesitant just because I have to say with the vaccines, in the beginning, especially pregnant women and lactating women were not included in the trials. And that worried me. Although mRNA vaccines have been around for a while, and that was like the big debate, and it was still being recommended in Canada, the fact that there were other countries that were saying no, absolutely not, pregnant women do not get it. For that reason, it made me a little hesitant. And then when I started working from home, I'm like, well, you know what? I'm just going to get it after I have the baby. There's no rush.
Trisha's case, I think, was even more interesting in terms of her perception of risk because she was a PSW doing home care. And, she had actually cared for COVID positive patients wearing PPE in their homes and hadn't caught COVID.
Mm-hmm.
It is more a sort of abundance of caution among women who are pregnant. And I'm basing this based on speaking to OBGYNs and saying, what are you hearing from your pregnant patients right now? Among those who don't want to take the vaccine, what's the reason? And there's like a handful of hardcore anti-vaxxers, but a lot of them are just saying something more along the lines of really the way Natalia and Trisha felt.
Mm-hmm. And how are Trisha and Natalia doing now? Have they been reunited with their babies?
So Natalia has, her son, Praise, is home with her and her fiance, and they are both smitten, and he is doing very well, and they are doing very well. In Trisha's case, she's had the opportunity to go back to the hospital multiple times and visit her son, Isaac, but he's still not quite strong enough to come home. They're hoping that will happen sometime in the next couple of weeks.
My days are very long. I'm not well myself yet, so it's kind of hard because, I want to go, I want to go and see him every day, but I can't. I'm not there yet.
And so what were the impacts, do you think, the emotional impacts of that separation on Natalia and Trisha?
Yeah, so both of them found that week they spent in isolation at the hospital very tough.
Hard, very hard emotionally.
Oh my God, it was horrible.
The hospital of St. Joe's in Hamilton tried to do their best to help them out. They, they would send pictures of the babies, and they, would put video calls on the phone and put their phone into the baby's bassinets. And the hospital actually figured out that 2 rooms on the COVID ward sort of overlooked the special care nursery, which was sort of in an adjacent wing of the hospital. So they could look out their window and nurses would hold their babies up to the glass in the special care nursery. But of course, none of this is like holding your newborn.
That was the worst experience in the world. If I would never have another kid in my life again after what I just went through. Because I feel like I had a kid, I couldn't even touch him. I don't know how women do it. All my kids, I gave birth and they were right up on my chest after. Mm-hmm. We were able to have that mother-child bond, and I remember I kept asking, that was my biggest fear even still now, because he doesn't know me. He doesn't know who, I know I carried him for 34 weeks, but he doesn't know who I am because I've only held him once. He's 12 days old. And I was so worried that he's going to get that bond with all the nurses instead of me.
Honestly, I just felt, I know this sounds a little crazy, But I felt like I missed out on the entire, well, I did miss out on the entire birthing experience. I missed out on the whole birthing experience. I didn't get any of the skin to skin contact. I had to wait a whole week before I even got to meet my baby. Like it was horrible. And then it kind of felt like, I don't know how to explain this, but it felt like someone just dropped this baby off and gave it to me, and that I didn't actually go through the process and give birth to the baby and experience all of that. It just felt like the stork literally came and dropped off the baby on my doorstep and was like, here, this is your baby. I just felt like I missed out on so much.
So do the women that you spoke to, Trisha and Natalia, do they want to get vaccinated now?
They do. They're very enthusiastic about it, and they want to make sure other women, pregnant women, do the same.
I mean, I know we're still in the early phases of all of this, and we won't know long-term side effects for a while, but any additional level of protection at this point is worth it. You don't want to have to go through what I went through. That's for sure.
So they're just waiting to find out when exactly they can get the vaccine after they have fully recovered from the virus.
I'll definitely do it now. I was so against the vaccine in the beginning, and even now I'm still like on the edge because I had COVID, but I think I would get the vaccine now, most definitely. After going through that, what if I would have got the vaccine? Then I got COVID and I didn't get as sick. The baby would still be inside of me, like everything would have been like, I would have been able to have the normal delivery and enjoy the rest of my pregnancy like I was trying to do.
All right, that's it for today. I'm Tamara Kendacker. Our producers are Madeline White and Kasia Mihailovich. David Crosby edits the show, and Angela Pacenza is our executive editor. Thanks so much to Kelly Grant. You can find her on Twitter at KellyGrant1. If you want to say hello, email us at thedecibel@globeandmail.com or tweet me at anima_TK. If you like this episode, leave us a review on Apple Podcasts, like this one from Fried Traveler, who said, a great way to be caught up on Canadian and world issues. Thanks, Fried. If you haven't already, wherever you're listening to podcasts, follow us so you never miss an episode. Thanks so much for listening, and I'll talk to you tomorrow.